1 to 4.
Good morning. I'm here today to inform you on high blood pressure. High blood pressure is considered hypertension in medical terminology. It is considered a normal value of 120 over 80 millimeters high. High blood pressure detection, it is recommended a person should get a blood pressure check on a regular basis. Most doctors will diagnose high blood pressure on 2 or 3 more readings, or on several occasions. Your blood pressure is taken. I'm going to sit up. Some people experience high blood pressure when they visit a doctor's setting, and this type of high blood pressure is called white coat hypertension. If a doctor suspects this, you may be asked to monitor your blood pressure at home, or asked to wear a device called an ambulatory blood pressure monitor, which you can wear it for 24 hours, and it records up to every 30 minutes. Explaining hypertension means high tension in the arteries due to increased pressure in the blood flowing through it. Here's a diagram of the heart, and it shows all the arteries and the veins in the heart, and how high blood pressure affects the heart, and how blood pressure rate flows and has a potential effect of expanding or breaking down the artery walls of the heart, which could cause serious heart conditions and could be potentially fatal. High blood pressure is tested. Quick and easy. Blood pressure is measured in millimeters of mercury. Recorded 2 numbers, the stochastic and the diastolic readings. Both numbers in blood pressure readings are important. As we grow older, the stochastic blood pressure is especially important. To test your blood pressure, your doctor will use a device called a sphygmomanometer. Blood pressure device can be bought at various places, such as discount stores. Here's a picture of the cup, which is placed around your arms, and the pump that pumps up. And here's the dial that records the stochastic and the diastolic reading. And the stethoscope is to listen to your heart after the blood pressure reading have been recorded. There are 4 categories of blood pressure. It's normal and pre-hypertension. And there's 2 stages, which is stage 1 hypertension and stage 2 hypertension. In the normal category, it is 120 over 80, and that would be considered as the normal blood pressure. And the pre-hypertension blood pressure would be 120 to 139 or over 80 through 89, and that is the beginning of having high blood pressure. And stage 1 hypertension is 140 through 159, and it would be over 90 through 99. And stage 2 is hypertension, is the worst one that you can have because it's really high. It's 160 over 100. And when the stochastic and the diastolic blood pressure fall into different categories, the higher categories mean that you have the worst type of hypertension or high blood pressure. Symptoms of high blood pressure is headaches, dizziness, faint, loss of consciousness, chest pains. All of those are symptoms of having high blood pressure. Who can develop high blood pressure? About 65 billion American adults have high blood pressure. It is common, very common in African Americans. Many Americans tend to develop high blood pressure as they grow older, but this is not part of healthy aging. Middle-aged Americans face 90% chance of developing high blood pressure during their lives. Others at risk developing high blood pressure are overweight, those who have a family history of high blood pressure, and those with pre-hypertension is 120 through 139 over 80 through 89 millimeters high. Blood pressure occurs more than often among African Americans than whites. It begins at an earlier age, more often and severe. African Americans have a high death rate from strokes, kidney disease than whites. Treatment can control high blood pressure in addition to lifestyle changes can prevent and control high blood pressure. This includes losing weight, increasing physical activities, and following a healthy diet. Prevention of high blood pressure. Prevention of high blood pressure is living a healthy lifestyle and learning more about changes in your diet. Less salt and sodium in your foods. Exercising. And if these things don't work, you can also consult your doctor for medication to get on the right medication to help you control this blood pressure. It is vital that when you do get on your medication, that you don't miss a dose. You take your medicine every day and you follow your diet as told by the doctor. You live healthy, you eat plenty of fruits and vegetables. And that is how you control your blood pressure and keep from having it. Thank you very much. And that's all I have to share about blood pressure today.
Thank you. Yay!
It is what it is. Thank you.